We'll kick off today with Dr. Nazim from the British Islamic Medical Association.
So my name's Assalamu alaikum. My name is Dr. Nazim, and I am one of the consultants from Glasgow, from the Queen Elizabeth University Hospital in Diabetes Endocrinology and General Medicine. I'm an honorary clinical senior lecturer at the University of Glasgow. And importantly, from the Ramadan guidance perspective, I am one of the two main co-authors for the BIMA Ramadan guidance. This comes on the back of the fact that I have published several papers now, alhamdulillah, in relation to Ramadan and fasting for Muslims, and largely diabetes, but also done some stuff on general Islamic medical ethics as well. So I was involved from the kind of oversight of this document, where we wanted to bring a form of guidance which not just incorporates, say, a common condition like diabetes, which affects our community, but other medical conditions as well, be it conditions that affect the chest, the neurological system, the cardiovascular system, and have some kind of guidance in place where healthcare professionals, so other doctors or specialists, are able to access this document and help make this guide patients in making decisions when it comes to their health in terms of fasting Ramadan or not. Now, often what is the case is that patients are not sure what to do, or they may wish to fast, and they go and see their doctor. The doctor may or may not be Muslim in the first place, so they might not fully appreciate what fasting entails. And importantly, they may not necessarily appreciate the condition at hand, because if they're going to see their general practitioner, their GP will certainly be familiar with their health, but not know the specifics of the individual problems, medical problems they may have. So the idea with this document is that we've got guidance on what to do with patients who have chronic medical conditions such as diabetes, high blood pressure, angina, or who get recurrent chest pain, asthma, and the like. And we've used a risk stratification table to help our patients be guided by healthcare professionals. I've just brought this up on the screen here. It's called a risk table and recommendation summary. These are not authoritative or prescriptive, but they're there to guide the clinician so that the patients can then be assessed and then be advised whether fasting is advisable or not. And we're using the criteria from the Diabetes and Ramadan Alliance, which is long-standing guidance, which is international, and use a traffic light system where red means advised must not fast, amber means advised should not fast, and green is low or moderate risk. And the decision to fast is based on the kind of discretion of the clinician, but also factoring things such as previous experience of fasting, their general health, age, etc. And even with each of these categories, they're not compelling, but it helps guide and start the discussion. So somebody might be in a very high risk group, might be adamant on fasting, and fasting isn't safe for them. That'll be very explicitly made very explicit to them, but there may be scope to at least help them fast. Equally, somebody might ordinarily be in a high risk category, but because of previous experience of fasting and having previous preparation, then fasting for them may actually be okay. So these conditions, I'll scroll through to give an idea of the extensiveness of this document: different respiratory conditions, cardiovascular conditions, chronic kidney disease, gastrointestinal system, neurological disease, diabetes, adrenal disease, the glands that produce steroids that sit above the kidneys, blood disorders, both benign as well as cancerous ones, cancer in general, rheumatological disease, obesity, pregnancy, organ transplantation, and even mental health. So it's pretty comprehensive. It doesn't include every single condition. This was prepared and produced over a course of a few weeks. I was certainly involved for the last 2 weeks of this. So the idea from a chronic disease perspective, we have this information. The rest of the document provides more details and guidance on the evidences that we've used to kind of base our recommendation, if there is any prior evidence, particularly from Ramadan itself, if not from non-Ramadan time periods relating to Muslims. And we've used clinical judgment where we have the absence of any explicit evidence. And clinical judgment is based on the advice of the person who has written the chapter, as well as peer reviewers. Each section has at least 2 to 5 peer reviewers. Some very how do you put it, very esteemed colleagues. We've even got a non-Muslim colleague by the name of Professor John Murray, who is the authority for heart failure in the world, who has been able to contribute in the heart failure section. So we really have drawn on a lot of evidence where we can, but if not, expert opinion to help make things as safe but also practical and pragmatic as possible. So that is all there in that document. And the final thing I want to draw people's attention to, that's all very well when it comes to deciding whether to fast or not when you've got a chronic disease or because you're old. But what to do if you're actually unwell, you become unwell during Ramadan, either before fasting or during the fast. And we have what we call sick day rules in figure 1, which allows, again, healthcare professionals to kind of signpost patients to look at. And what we've done, because of the context of COVID in the present circumstances, we've got a COVID arm and a non-COVID arm. The idea is that this can be reviewed on an annual basis based on what the prevailing medical conditions are at the time. So just to make it very simple, we've said that if you've got COVID-type symptoms, fever, malaise, or persistent cough, then we've advised breaking the fast if you started fasting or abstain from fasting. This is not, we're advocating this because we understand the implications of what COVID is doing to a lot of our patients when they get it. But at the end of the day, it's a decision of the individual to make it. And we're advising that they take adequate hydration, contact the medical services, and only to resume fasting when they're back to normal, but to seek help, guidance from a medical practitioner first, because sometimes they might not appreciate things. With non-COVID arms, if you're not feeling well, just like if, say for example, you've got an infection on the skin, or you've been having diarrhea or vomiting, again, we're using really kind of guidance we have from fiqh in terms of using the kind of criteria that's usually outlined in it, in that if somebody has an illness which will, through fasting, get the illness will get worse, or the recovery is going to be delayed from fasting, or there's as a substantial fear from that, particularly if I'm a healthcare professional advised, then they'd have legitimate reason to break the fast from a Sharia perspective. So this guidance is there to really guide people in terms of the backdrop to their health, but as well as in relation to the acute side of things if you become unwell during Ramadan. And two important points I want to kind of conclude with. One is that the rules related to social distancing always remain. This does not, Ramadan is not an excuse to kind of waive these things. So all the prior rules and guidance have come from the government and public health authorities. This is compatible and is indeed upheld, and we advocate following these. And secondly, as well, when it comes to the kind of medical symptoms, this is an evolving matter. So if things have been updated, particularly from the NHS website in terms of specific symptoms, then we would be working in tandem with this, and we would update our guidance in accordance with this. We are not there to kind of be at odds with them. Back to you, Sister Zainab.
Thank you so much for that. It was very extensive. I have one question to get us kick-started. It's not necessarily Ramadan related, but more generally regarding the pandemic we find ourselves in. Speaking to lots of professionals and healthcare professionals, they've found that many individuals who might find themselves to be unwell, but not necessarily COVID, are reluctant to speak to their doctors or try and get a doctor's appointment because they, number one, don't want to take up precious time in the NHS, and number two, are worried about visiting clinical facilities and then potentially contracting COVID. Would you have any guidance or advice to offer on that?
Yes. So the advice from and very much the message from the NHS is that we are very much open for business. If you have concerns about your health, we are still there. Yes, there has been redirection of resources, particularly in terms of dealing with emergencies relating to COVID and the screening of COVID, but we are stabilizing in relation to that. There's been a lot of extra manpower added to the NHS. So we advise, we advocate, and we indeed oblige people to seek medical advice. This is why we prepared this document, because this document can be accessed by a healthcare professional. You can have a virtual consultation either through telephone or whether it's a Zoom type call, and you can have that discussion. They can access your records. You can have a conversation on the matter. So there's definitely a scope, facility to do so. You won't contract COVID by seeing your GP because you don't necessarily need to see your GP in person. And equally, if social distancing rules are observed, there's nothing wrong with, again, having a discussion in person, particularly if blood tests need to be done or prescriptions need to be written or whatever it may be. The most important thing that we advise is that if people have any concerns about their health, they seek medical advice so they know the right thing to do. And if after getting the medical advice they have any reservation of either deferring the fast to later on, or being advised to break the fast if they become unwell, or if indeed fasting is not applicable appropriate for them because of their general health, and fidya is a more appropriate thing, to seek further discussion with the religious authority, going with information that has been provided by their doctor if they require a bit more further reassurance or understanding or clarification.
Thank you so much. I've got a couple more questions. What dietary advice can you give for this Ramadan to help with fasting and also our respiratory health?
So I think the most important thing, general advice that is out there throughout the World Wide Web, very robust advice that has been consistent over the years, does not get suspended or get replaced with anything that is there this time. And what we are saying is during the period of between Maghrib and Fajr, to hydrate oneself adequately and appropriately and in a sensible manner so that they are prepared for Ramadan. What the important thing is that you don't kind of drink the bare minimum you need just to ensure that you won't feel thirsty or whatever. Understand that the days are a bit warmer at the moment. It will take our body a few days from a physiological perspective to get used to the demands from that alone. So drink more fluid is probably the most important bit of advice we can give. You might find that you are passing urine for Britain for a period of time, but your kidneys will adjust and your body will adjust as well. But certainly for the first few days, I'd advise drinking a bit more. So we say as a general minimum around 2 liters a day, but maybe an extra half a liter or whatever may be beneficial in those initial days. I think hydration is the key, and we've highlighted specifically from the COVID specific criteria guidance that people can get dehydrated quite quickly, and we're advocating if there's any fever, because it is one of the hallmark symptoms of COVID. It may not be, but it still could be, that we don't advise people to fast, because ordinarily with fever you will sweat and you will dehydrate anyway. So there is legitimate reason regardless of COVID when it comes to fever and fasting.
Thank you. And another question we've had is, will the COVID-19 test break my fast if I get offered to take it?
From what I gather, it's a dry swab test, so in and of itself, no, it shouldn't. Even if it were to make somebody gag or even vomit a bit, the vomiting in itself, as you know, would not be something that would invalidate the fast unless one were to swallow a mouthful or more of their own vomit. So I think it should be fine. I think, again, if somebody's getting a swab for COVID, I don't think they should really be fasting, because you're not going to be screened unless there's a good reason to be screened. The only caveat to be that maybe if you're a relatively healthy worker who perhaps is affected, but again, I think 9 times out of 10, if you're being screened, you probably shouldn't be fasting in the first place.
Thank you, of course. And we've had another question asking about the benefit or perceived benefit to wearing masks and face coverings. And I appreciate that this is sort of being discussed by public health and by medical professionals. But in your advice, would there be any benefit to wearing face masks?
I'd say unless you're in a particular environment or your job is such that it necessitates you to wear it, I think at this point in time, although there has been usage of voluntary wearing of masks in public or in mass usage of masks in some countries, at this point in time in the UK, it has not been advised to wear a mask. If people choose to do so, it is their personal choice, but the general advice is that you're advised not to wear a mask. The other thing with wearing a mask is not everybody's accustomed to wearing a mask. It might make them feel a bit kind of claustrophobic, might make them feel a bit funny or unusual, might actually dry their mouth out and therefore give them a sensation of thirst even though they're not dehydrated, and may make the fast very difficult. So my advice is go by whatever advice has been given by government and by the public health authorities, whichever part of the UK you're in. And inshallah, that's probably the best and most safest advice to follow.
Thank you, that's really helpful. And another question we have is, what advice can you give to the elderly who shouldn't be fasting because of their age and condition, but may still want to fast at this time?
Again, fasting is the responsibility of the individual concerned who is fasting, and there's plenty of scholars and imams and shayukh have elaborated on this. But I take a very pragmatic approach from a medical perspective. I have studied Sharia myself, alhamdulillah, for a good 8 or 9 years. I'm fully acquainted with things in terms of the kind of balance between things. It's an individual choice, but I always remind people the purpose of Ramadan isn't necessarily to fast. The purpose, as you know, is that in taqwa. Taqwa means adhering to that which pleases Allah subhanahu wa ta'ala and abstaining from that which displeases Allah subhanahu wa ta'ala. It's explicitly mentioned in the Quran, if it's explicitly there from the Sunnah and from the examples of those who have been our scholars of our time. Allah is not in need for us to put ourselves in difficulty or to become a hard man or a hard woman in this circumstance. He wants us to submit to the circumstances that He Himself has created, to see whether we are there to doing things to please Him or whether we're there to satisfy our own kind of internal feeling. Yes, it's good that we should feel well about ourselves. We should understand who ultimately we're fasting for. We're fasting for Allah subhanahu wa ta'ala. So therefore, if there's a clear reason from the Sharia that a person should be abstaining from fasting, then what are we fasting for? There's no need for it. If you simply put yourself in difficulty and then put yourself at risk where you either become unwell, such that you either need admission to hospital or you need to seek help from a doctor, or you worry your loved ones, then that's not very responsible behavior. Part of fasting is to be responsible that you don't cause difficulty or grief to other people as well. And we know that the Mufti of Egypt has given fatwa on this, saying that it would actually be makruh to fast when there's actually no need to fast because of the aforementioned reasons.
Thank you so much. And I think my final question to you would be, are you able to reiterate where people can find any resources or guidance published by BIMA and how people can stay in touch?
Yeah, so the BIMA website itself has the online resource on the website. There's also a link to the South Asian Health Foundation, which actually signposts the MCB as well. Diabetes UK has stuff, and indeed a lot of the kind of societies and bodies for different systems. For example, the British Gastrointestinal System, Society, the British Thoracic Society, they have, wherever possible, signposted to the guidance as well. So I think the simplest thing would be to Google either BIMA Ramadan guidance or MCB Ramadan and fasting and health guidance, and you should be able to access these links. Certainly, you should have direct access to the link that we have for BIMA, so you can certainly share that. So we're trying to cross-share all the links on different platforms as possible through different outlets, whether it's WhatsApp, Twitter, Facebook, so that people can access things. Lots of people will have either friends who have access to these links as well. And hope is that as the various guidances become more established and become more familiar, more and more people will share it. And I know that we are trying to get things on the kind of more generalized NHS websites as well.
Thank you so much. And I believe that BIMA have a special email address for any questions or queries, which I believe is ramadan@britishima.org.
Yes.
As we mentioned, the MCB has a host of resources for Ramadan, which are available all on our website, which is mcb.org.uk/Ramadan.